Hi, my name is Pre-Med Doctor and welcome back to another lesson. Today I'll be talking about the CanMEDS rules. Essentially, as you're preparing for ABS, essays, and even your interview preparations, you should always be keeping the CanMEDS rules in mind. All medical schools utilize the CanMEDS rules in different ways to evaluate candidate applications, so it's very important to know these rules extremely well. Although it seems relatively straightforward, I want to go over this topic because I'll be referring to the CanMEDS rules very often in future videos. The CanMEDS framework is what the Royal College of Physicians and Surgeons of Canada considered the standard rules a physician practicing in Canada should embody. There are a total of 7 rules: communicator, collaborator, leader, health advocate, scholar, professional, and medical expert. In the video, we'll be briefly going over each of these roles so that you'll understand how you can ensure that you incorporate these into your application. Communicator. It's no surprise that good doctors are good communicators. Physicians need to communicate important information to patients and their families and establish good therapeutic relationships as well. Some keywords to think about include active listening, breaking bad news, shared decision-making, and rapport. Now think of some ways to highlight how you've been a good communicator. Were you ever put in a position where you had to break bad news to someone? Were there instances where you needed to form relationships with others in a professional setting, such as in a mentorship setting or a patient volunteering position? These are all examples of communication, which you can highlight in your application. Collaborator. Physicians do not work alone. They always work in a team environment with nurses, social work, physiotherapists, pharmacists, and other hospital staff. They even work with other physicians of other specialties. This interprofessional environment requires good doctors to be good team players. Some keywords that come to mind include conflict resolution, recognizing one's own roles and limits, respecting others, and teamwork skills. You must include in your application instances of where you worked in a team environment in order to show that you're effective in a team environment. Did you ever take part in conflict resolution in your school club? Or work with people of many different backgrounds in your part-time job? Keep these examples in mind for your application. Leader. In a healthcare team, physicians are often the leaders from the patient level to the health system level. Therefore, it's essential that applicants are comfortable with making decisions and managing a team. Keywords that relate to this include consideration of healthcare resources, management of personnel, negotiation, personal leadership skills, and leading change. In order to exemplify this, you must have leadership experience prior to applying. Were you part of the undergraduate student council? Have you ever had to manage an entire class as an instructor? These are some of the many examples that would show the admissions committee that you have the capabilities to be a leader as a future physician. Health advocate. Not surprisingly, doctors have the responsibility of being health advocates. This includes advocacy on a patient, community, and population level. Keywords related to advocacy include health promotion, health equity, quality improvement, determinants of health, disease prevention, social accountability, and mobilization of resources. Have you been chair of a mental health advocacy group at school, or been researching health disparity in patients with low income? Utilizing your position and privilege to improve the health and well-being of others is key to becoming a good physician, and the admissions committee wants to see that you have a passion for this. Scholar. Medical advances are happening every day. Doctors need to be up to date with the latest developments to provide the best care to their patients by learning, teaching, and contributing to medical knowledge. Scholar-related keywords include lifelong learning, self-improvement, teaching, role modeling, providing feedback, information literacy, scholarship, and scholarly inquiry. Having strength in research, awards, and teaching experience will undoubtedly give you an edge when it comes to being a scholar. Do you have poster presentation awards, research publications? How about having the ability and willingness to learn new things? All of these are examples of being a scholar. Professional. Because physicians are entrusted with many responsibilities, They are held accountable for their care of others as well as their care for themselves. Keywords connected to professionalism include 1. Commitment to patients, like integrity, professional boundaries, confidentiality. 2. Commitment to society, such as social accountability and societal expectation of physicians. 3. Commitment to professional, including code of ethics and commitment to standards. And finally, 4. Commitment to self, like career development, resiliency, and commitment to disclose medical error. Although this definition is rather specific to physicians, being professional as a student can be manifested in many instances. For example, have you been able to take care of yourself in the busy university environment? Have you ever had to admit fault? These are all instances where your professionalism needs to be evaluated, both by yourself and the admissions committee. And last but not least, medical expert. This is definitely the most difficult to apply to your life as a pre-med student. This is an integrative role. A good physician is able to integrate all the other 6 roles together in their everyday practice. Although it may be hard to explicitly include this in your application, exposing yourself to medical-related activities may help you discover the medical expert role. For example, say you had an opportunity to shadow a doctor or work closely with staff at a nursing home. You may be able to get a taste of what it's like to integrate all the roles together. I feel like this is an extremely important role to think about, especially when it comes to understanding why you're applying to become a doctor in the first place. In summary, there are 7 CanMEDS roles you should familiarize yourself with: communicator, collaborator, leader, health advocate, scholar, professional, and medical expert. In the next lesson, we'll be applying the CanMEDS roles to the first ABS section that I'll be going into in detail: research. Specifically, I'll also be going over how to apply for research, whether publications are important, and whether you need research for medical school. If you like what you're seeing, please send this course to your friends. See you in our next lesson.